it's great to have you with us for In Focus Recash. I'm Dora Amamuya.
And I'm Kent Kingston. This week we've unearthed some hidden gems from the In Focus archives for you. Timeless, I tell you. Our nutritionist Sue Rad uncovers some of the hidden chemical nasties that can sneak into our food. But it's not all doom and gloom today, Dora. We've got a great interview coming up with a doctor who has a vision for a children's hospital in Sierra Leone.
Yes, but first up, let's meet again the founder of CHIP, the Complete Health Improvement Program that is still changing lives around the world.
It's a pleasure to welcome Dr. Hans Deal to the program. Dr. Deal is the founder of the Complete Health Improvement Program. Thanks so much for making time for us while you're here in Australia.
Glad to be here.
Now, what is the Complete Health Improvement Program, also known by its acronym CHIP? It's not about eating chips, is it?
No, not really. No. No, CHIP is really an intensive educational adventure that's reaching out to people to offer them the fuller life, the richer life, the longer life, and also to help them to die younger as late as possible.
Wait a second. To die younger later. Let me just unpack. You mean live longer, healthier?
That's right. That's right.
Okay. So this is, how broadly has this spread? I mean, how well established is this program?
Well, the program is really developing a global presence. It's in Dubai, it's in Germany, it's in the UK, it's in New Zealand, it's here in Australia, it's in Canada, it's in Germany, it's in the US.
Right, so it's all over the world.
It has about 50,000 graduates, and it's really exploding.
Wow, and you're sort of looking at a trajectory of the people going through it, and it really has gone up fairly substantially in recent years. So what kind of benefits are earned by this program or incurred by going through the program?
Well, it really focuses mostly on chronic diseases because these are diseases that sort of hang around, and we have no really good medical cure rates for those kind of diseases because they're largely related to our lifestyle, how we eat, how we drink, smoke, exercise, and this is the challenge that we have. How do you motivate people? How do you educate people? How do you inspire people to do things that we all know we should do, but it's hard to do?
That's right.
And so the CHIP program then is trying to aim for hospitals, it aims for schools, it aims for corporations, it works through churches, it really tries to reach whole communities to create a network where people can support each other.
Now, chronic diseases really cost nations a lot of money now, don't they?
It's estimated that probably 75% of the healthcare dollar that we spend in most societies today goes for chronic disease management. Wow. Not cure, but management.
Right.
But I think with CHIP we can offer people something more like a cure. We can begin to reverse these diseases. The
reverse the lifestyle problems. Now, you brought a video with you about one person who's gone through the program. Let's take a look at that, and then we'll continue our conversation after we watch the video.
I thought life was just great. I felt well, and then bang, I got told you've got 6 arteries that are blocked and 99% blocked. And so that was a bit of a surprise. I had to have 5 bypasses. After that, after getting over the operation and what had to happen there, I went back onto my normal diet, which I thought was great. I had a good diet, I thought. Went back and had blood tests, and I was surprised. My cholesterol was raised, blood pressure was up, and at that point I was introduced to the CHIP program. I went onto it immediately. Straight away I thought, I have to do this. Within 2 months of going on the CHIP program, all halved. My cholesterol was halved, blood pressure was down. In fact, I had to lower my blood pressure pills because I was getting dizzy. So, hey, that was great. And then that's allowed me now to get back into the things I love. 2 weeks ago, I got back on the bike, and one thing I really noticed, when I used to bike before, I was always out of breath. I went out 2 weeks ago, I hit the hills, and I didn't even get a sweat. I was doing some marvellous riding, you know, getting back on the bike, biking with my friends, living life to the full. And to me, that my life is just beginning again.
Well, Dr. Deal, that was really quite a remarkable video. I mean, what a turnaround in that guy's life.
It's a new man.
Yeah, it is.
And we see this over and over again, not just in months, but oftentimes we begin to see these changes taking place within days,
Wow.
within weeks. Blood pressures come down, cholesterol levels come down, medication requirements go down. I mean, we are astounded ourselves how the body begins to repair itself.
Wow. And I guess, this is one particular case. We've talked about this going global, but what are we talking about here? You're just in a stage, I guess you'd say, where this program is getting kicked up a notch. Am I right?
That's right. What we're seeing is that we can reach whole communities. We have a city near Chicago where we have 6,000 graduates,
Right.
20-some restaurants that are serving healthy, wholesome foods. And we want to spread this kind of a concept across the globe. And we're really excited in working with the Lifestyle Medicine Institute now to spread the word in this fashion.
So the Lifestyle Medicine Institute, did I get that right?
That's right.
That's right. Is actually owned by the Seventh-day Adventist Church here in the South Pacific. So it's kind of a change of model, because obviously up until this time this program was based in the U.S. You see that this is going to somehow bring together a sort of a melding of the program with the expertise that the church and associated entities have here in Australia?
We're very, very excited because we're bringing the best of core values together.
Right.
To helping people, to reaching out to people, and not just to meet the physical needs, but perhaps to also go a bit deeper, where people really hurt, where people look for answers. We think this is a God-sent program.
Wow, that sounds amazing. Now, as you said, 75% of our healthcare spending is on this. Are you looking at a government's interested in this, as a broader society? I mean, this is an opportunity, if this program really does spread broadly, to change. It's a game changer.
It could be a revolution, and that's exactly what we need in our society today. We need it globally, because these chronic diseases like diabetes, it's like a tsunami.
Right.
Hypertension, overweight, heart disease, cancer. These are the kind of diseases that we can only conquer if we begin to get people involved in working together with the medical profession.
Now, if people, obviously a lot of our viewers are going to hear this, they're going to be excited. Viewers like me are thinking, I better get in this program. How can we get more information? How do we get involved? What if we want our church to run a program? Where do they find out information?
Well, I think they can go to our website, and the website is www.chiphealth.com.
Right, okay, so viewers, it's right there up on your screen. I highly recommend that you go there, find out about it. You might want to run a program at your church. This is really a tremendous service that you're providing, and it's a great privilege to have you here.
It's an exciting venture for me. It's a joyful adventure. Thank you.
Boy, he's keen about his topic, isn't he?
Yeah, and so energetic. Did you know he's actually turning 70 this year?
Wow, very impressive. You know, my wife actually did the CHIP program a year or so ago. She got a lot out of it, and certainly there are a number of people in her group who had quite dramatic results. Weight loss, reversing their diabetes,
Awesome.
people even, their doctors telling them, look, you need to go off your blood pressure medication, you're doing fine. I'm telling you, it's for real.
Yeah, it's so cool.
Life-changing, Dora. That's what it is. Life-changing, but not channel-changing. Don't touch that remote. We're taking a quick break now, but we'll be back in a flash.
We live our lives running around, rarely stopping to ask ourselves where we're going and what our final destination is. In the end, our lives become little more than routine. Step beyond and discover a path that offers comfort, love and hope. Visit hopeoffer.com/step beyond or call 1300 300 389 for your free copy today.
Father, I can't connect the dots through the little that I understand. What words can I say to reach you? How can I know that you are there, listening, hearing, caring? My words are broken, weak, and powerless. But I know your power is limitless. What can I say?
Planning your future can be a daunting task. What you want to do, who you want to be, and the road ahead can often be unpredictable. No one really knows what the future holds. Avondale. It's education designed for life.
Hi, welcome back. Now, our resident In Focus nutritionist and dietitian Sue Rad has given us a lot of great advice on eating healthy. In fact, there's a whole back catalogue of her segments for you to view and share at infocus.org.au. But it's not just what we eat that matters.
Yes, it's also how we cook it. Check this out.
I mean, I'm talking about advanced glycation end products. Now, that's a mouthful. That's why we have Sue Rad. Age food, stuff in foods that can age you.
Absolutely.
Yeah, tell us about it.
This is all very new,
Okay.
very exciting research, and ages are substances, chemicals in fact, that are formed in your body, but also that we can get through food, particularly certain types of foods, and how you prepare those foods is crucially important. But why are they a problem, for starters? Well, we know that these ages, as they're called, actually promote oxidation and inflammation in the body, and they are underlying processes that pave the way to disease.
So this is the stuff that's in our food or comes into our food through cooking?
Yep, and if you have diabetes, it strongly brings on the complications of diabetes earlier, and it also shortens your lifespan. In a sense, we've known about it for a while, but we thought it wasn't an issue because we didn't think we absorbed these ages from foods. But now we know we absorb at least 10%, and 2/3 of what we absorb actually gets deposited in your tissues right around the body, where it's biologically active and it can do harmful
Look, I was sitting here thinking, this doesn't affect, I shouldn't tell you, Sue, but this doesn't affect me. Then I thought, whoa, 2/3 of what I absorb stays in my system?
Yes. Yep, and it can wreak havoc,
And
especially
what
in your blood
foods?
vessels. Yeah. So the foods that have the highest content of ages are your animal products, things like meat, fish, chicken, and even high-fat cheeses like Parmesan cheese or brie cheese. They're loaded in ages, and that's even before they're cooked. So they're naturally very high in ages. But if you cook them, James, the last thing you want to be doing is cook them using a high-temperature, dry heat method.
Like a barbecue or
like
frying?
Like a barbecue or frying.
Deep frying?
Deep frying, shallow frying, dry frying, roasting, you know, all those things that make foods usually taste better or smell better. So it's quite deceptive, really. You want instead to be steaming, poaching, braising, having soups, things like that. Now, the foods that are lowest in ages, of course, plant foods. So your fruits, your veg, your whole grains, your legumes, they're much, much lower. It doesn't really matter how much you cook, how you cook them, unless, of course, again, you cook them using these high heat, dry cooking processes. So people who have snack foods like crisps or crackers, donuts, actually, even though they might be vegetarian, are exposing themselves to a high intake
Well, that
of
makes
ages.
sense. You've got lots of chips and you've got a lot of fat and stuff. It's in a high heat oven, it's dry heat, and you come out with biscuits.
Yeah, not a good idea.
Oh, okay. This can get a little bit complicated. When I started to think about it, it's such new information for me. My mind started to reel, thinking, what I'm eating today is actually going to save me for a long time.
Absolutely.
How do you prepare your food?
Well, the best ways really are the old-fashioned grandmother ways. You know, the great-grandmother used to cook by boiling things, steaming things. That's very safe. You really retard the formation of ages. Poaching things, having more soups, very, very safe. As soon as you use these modern high-temperature cooking methods, you increase the formation of ages. And the important thing is you can't feel the damage they're doing you now. But we know, based on animal research, they are strongly bringing on disease, and particularly if you have diabetes already, they're going to bring those complications earlier, so you want to avoid those.
Well, thank you, Sue, very much. This is really only introduced to the idea today. Age. The food that you eat can age you. If you'd like to know how to more safely prepare your food, then head across to surad.com. And I look forward to seeing you the next time that we talk about this, Sue, because, wow, it's going to change the way I prepare my food.
It should, James. It can help you stay healthier and feel better for a long time.
Great advice, but Dora, honestly, when she mentioned some of those delicious cheeses, it just about broke my heart, I know,
so Devo. But I know she loves Greek food, so I'd be really interested in what she has to say about Tazanaki.
Oh, yes. Fried goat cheese. Oh.
Still, the greatest thing about Sue is that she can suggest alternatives, yummy ones, and some of those recipes are to die for.
Yeah, or to live for, I guess.
Yeah, whatever, Mr. Technical. Anyway, time for a break now. We'll be back soon.
Onions add great sweetness and flavour and a good base to any curry. Going to add some ginger, some garlic. Look at that. nice and chunky. So we've got our spices, gives it kind of a Sri Lankan feel. Add some tomatoes, tomato paste, some honey. Roasted vegetables in these kind of dishes are always great. But we add some creaminess to it. And that dish is now finished, ready to hit the table. I recommend you to give it a try, and it's so easy.
Hi, welcome back. Now, this next interview goes way back to 2010 when James Venegas was hosting the program. Hi, James. You're going to love this guy, Dr. Nuli Lemo.
Yes, and stay tuned because we'll give you a bit of an update on his work after we've seen the interview.
Sierra Leone in West Africa is one of the world's poorest nations. Still recovering after more than a decade of civil war, Sierra Leoneans experience high levels of illiteracy and disadvantage. The average Sierra Leonean will not live to 50, and childbirth is a dangerous enterprise for both mother and baby. Enter Dr. Nuli Lemo, who has lived in Australia since he came here to study medicine in the 1960s. But, as they say, you can take the man out of Sierra Leone, but what's the rest, Nuli?
You can't take Sierra Leone out of Nuli Lemo.
And welcome to the program, Dr. Lemo.
Thank you.
Now, before we get into your more recent activities, what brought you to this country to study here in the 1960s?
Interesting question. I guess it was probably poverty.
Okay.
In the sense that when I finished high school, which is another big event,
yes,
I had no way of going to England to study medicine, which was the usual place most of the Sierra Leoneans went.
Okay.
Out of the blue, Australia, through the Special Commonwealth African Assistance Plan, which they call SCAP, offered 5 scholarships to Sierra Leone, 2 medicine, 2 agriculture, 1 veterinary. And the candidates were asked, the government in Sierra Leone was asked to nominate the candidates,
yes,
but the candidates were then to directly interact with the Australian Education Department, Commonwealth Office, like write an essay and that sort of thing to be eligible for the scholarship.
Okay.
So I was asked, and my request was to write an essay of about 300 words why I want to come and study medicine in Australia. My geography of Australia was, there was Australia full stop. I knew nothing else. And so I did my research, and one of the English teachers was actually there who'd been a Navy man. I asked him, he said, oh yes, Australia, the good people are good. He said, but I tell you one thing, if they kick you in the backside and you kick them, then you get on very well with them.
Now, a young man in Australia from Africa at a university, there wouldn't have been many Africans, let alone Sierra Leoneans back then in the 60s. What was it like for you?
It was very, very trying. I was the only African in the whole of the medical faculty from first year to 6th year medicine. And it was not easy. I remember the first few months I sit in the lecture hall and I can stretch my arms. Nobody was keen to sit next to me.
Yes.
That's how trying it was.
Wow, a different world back then.
Yeah.
And it was pediatrics, a pediatrician is what you decided to study.
Yes.
What led you to that? That's a children's doctor, isn't it?
A children's doctor.
Yes.
That evolved. It was essentially when I did my residence in Wollongong Hospital. I had done the usual surgery, medicine, obstetrics, but I did my pediatric term under one Chinese pediatrician. And suddenly this man was so wonderful towards children that I said, I'd like to be like that person.
And that really inspired you. Do you have children of your own as well?
I've got 4 children.
Yes.
1 boy and 3 girls. They're all grown up.
Obviously that would have played a part at some point as well.
Absolutely.
Now, Sierra Leone, I think you went there for 10 years to work, is that right?
That's right.
What was it like after working in Australia to now work in a developing country in the area of medicine and as a doctor?
One answer to that question is what my daughter, who was about 9 years old, Tonya, said when we got to Sierra Leone to Bo. We've been in the country for less than 3 months. One Sunday morning we're having breakfast. And Tonya, out of the blue, said, Dad, I know why you brought us to Africa. I said, why, darling? You brought us to suffer, didn't you? I said, why? Well, in Australia we had electricity. In Bo, no electricity. In Australia, we had running water from the taps.
Yes.
Here we do, etc., etc.
Yes.
So I told her, no, Daddy brought you here so you can see where your daddy came from.
Mm. And was it in those 10 years that that seed was planted to one day build a hospital there, a children's hospital?
The children's hospital, yes, but to go back to work there was actually before that.
Okay.
When I met my Australian partner, later became wife,
Yes.
one of the conditions was I said I'd like to go back to Sierra Leone and work as a doctor. I said, any girl I get involved with, please. She said, no problem.
Yes.
So we went back there, and it was really because I had had a scholarship from the district council. Otherwise, I wouldn't have gone to high school.
Yes.
And because I had had the money after working as a garden boy to pay the last primary school fees from Esther Keslick, the
Yes.
American pastor's son, Victor. Otherwise, I wouldn't have finished primary school. Because of all those engagements, that help I had received, I felt I should go back and work.
You've been dreaming and planning this project, this children's hospital, for some time. What sort of a hospital do you envision in your mind?
I envision a children's hospital that is totally under the care of the community. So we're calling it a community children's hospital in Bow.
Okay.
And that hospital, the big emphasis are going to be both education and care. Education for parents and any other person needing education about child care and child health. Mm-hmm. And then, of course, basic medical care.
Now, you're a man of faith, as I understand. In particular, you're a Seventh-day Adventist.
Yes.
How does your faith impact your work as a doctor and this project in particular? How does your faith influence it all?
The short answer is that now I feel not alone, that because I have faith in God and because God has proved over and over again for this project to go on and even for me to be here, that faith has been the key driving force for me. For example, when I started, I was talking to a friend quietly about this project. Said, oh, you've got to let somebody know. But I have been praying to the Lord, please, Lord, bring people in that will make this project a success. And it's happened over and over again. As we go on, I'll tell you.
Well, I've listened to your story, and I can see the Lord's leading all the way through, from start to finish. Now, how's the planning going? Is construction underway?
Construction has started. The foundation stone was laid on the 25th of February this year.
Okay.
And we were joined by 2 Rotarians from England, Bournemouth, and then my wife and I went there as well. And the Bow Rotary Club has been the key factor in really also working on this, and there are Christians there who are also totally committed to this project. So it started, and there's 3 stages, stages 1, 2, and 3. The slab for the building for the 3 stages has been laid.
Fantastic.
And stage 1, which is a mini hospital, is going to be has started, and they hope it will be finished before the end of this year.
Fantastic. So it's underway.
It's underway, well and truly.
Now, where do you get your funding for this? I mean, how do you fund an entire hospital? Tell us a bit more about the funding side of things.
Again, just one of those things, and no doubt God's guidance. One of the key things was the International House, Sydney University International House Alumni Association. My wife and I met in the International House. I was president of the International House for 3 years, the alumni, and they have offered to pay 1/3 of the total cost of $300,000 for this hospital.
Wow.
And they've raised most of that money already.
Incredible.
Then I belong to the Rotary Club of Tarramara. My club is also totally committed. And there are other Rotary clubs in Sydney, and then the Rotary Club in Bournemouth. And then our church, Sydney Adventist Church, Fox Valley Community Church, has been very, very helpful.
Now, just a quick question here. Our viewers, is there any way that they can help? Can they contact you in some way if they want to support this project at all?
Yes, there is information. There's a newsletter brochure that is available, and there are ways of helping out. And also the Rotary Australia World Community Service, called ROCS, they provide tax-deductible facilities for this project.
Fantastic. So the Bow Children's Hospital. Now, Nuli, building a project such as this requires beds, medicine, equipment, staff. Where are you going to get all of this for the hospital?
The Rotary Club in Sydney has a place where they collect various equipments, already have some beds there. An International House alumni member, a German fellow who's spent most of his time in Australia, goes there. He has contacted drug companies and medical equipment manufacturers in Germany. They are prepared to help. Then the Sydney University International House, Sydney University Children's Hospital in Westmead, they have also offered an online training for pediatricians.
So this is internationally. How about in the country itself? They're going to use some locals just briefly?
Yes, in the country itself, the locals, we have the Rotary Club has got solid foundation. There are builders, architects, and so forth. And there will be fundraising. In fact, during the foundation stone laying, just out of the blue, towards the end of that ceremony, they raised nearly £1,000 sterling.
Wow. Now, that is absolutely incredible. I want to thank Dr. Nuli so much for coming on the program today and sharing this project, his passion, his vision with us. Thank you very much for coming.
Can I say one thing?
One more thing?
Yes.
Sure.
One of the things that has led me most or helped me to keep going is a statement I came across in an African wisdom diary. An African mother was bending down, feeding her 10-month-old boy standing up and sucking from mother's breast. At the bottom of this picture is a statement by Thurgood Marshall, the first black justice in the US. None of us got where we are purely by pulling ourselves up by our bootstraps. We've got here because someone bent down and helped us. So please help.
He's very humble, isn't he? But pretty determined, I reckon.
Yeah, definitely. Like, that interview was from 2010. Looking at their website, it looks like they started building sometime in 2012. And they opened the hospital in 2013.
And they're still expanding that hospital, but in the first year alone, they treated more than 2,000 kids.
Yeah, it's so awesome. And it's great to know that there's still so much support from here in Sydney, from the Rotary Club, people at the Sydney Adventist Hospital, local churches, and plenty of others.
Oh, fantastic. It's great to see how much one person with a God-given dream can accomplish. And I'd say that's probably not a bad way to finish up the program today, Adora.
Yeah, it's been a great program and we hope you guys have enjoyed it. Thanks so much for your company.
God willing, we'll see you again next week. All the best.